All right. Well, good afternoon, everyone. I think we'll go ahead and get started, and then as other people join us, they can hop on. Just wanted to welcome you to the September Iowa Has Heart webinar series. And we are excited that you're here joining us today to learn about Know Your Numbers. I just wanted to welcome you. My name is Leslie Mesta, and I am the Executive Director here at Iowa Heart Foundation. And just wanted to share for those of you that may not know about us, but we are a nonprofit organization that were founded over 30 years ago by the physicians at Iowa Heart Center. And as you see on the screen there, we are dedicated to heart health education and heart disease prevention. So we work on the public health education side and also provide continuing education for clinicians. And through that partnership and the work that we do around prevention, we are fortunate to work with today's guest. And Diane McElhaun is the registered dietitian with the Mercy One Iowa Heart Center Prevention and Wellness Clinic. And if you've been joining our webinar series, you know that she's a frequent speaker for us. So I just want to thank Diane for giving us her time and volunteering to educate Iowans about their heart health and how the food that they eat really impacts them. She also provided our webinar on hydration and the impact it has on your heart health. And today she's here to share with us about Know Your Numbers. So without any further delay, I'm going to turn it over to Diane. So thanks for being with us today, Diane.
Thank you.
Diane's going to take a second. She'll start sharing her screen and then we'll get into it.
All right. Well, thank you, Leslie. So today we're just going to talk about Know Your Numbers. So, sometimes when we go and visit our physicians or providers, they'll just say, yep, everything looks good. But I really challenge you to delve a little bit more into that and find out actually what the numbers are. So numbers, I think, that are important include BMI, blood pressure, cholesterol, both the good and the bad, also triglycerides, your glucose or blood sugar. And one we don't think about very often is waist measurement, but I think that's very important for cardiovascular health. As far as BMI, normal is under 25. Overweight category is between 25 and 30, and then over 30, BMI is classified as obesity. BMI is based on height and weight. So it's just a relationship between those, and there's a formula that we use to calculate that. The one limitation I would say with BMI is your fitness level, muscle mass, bone structure. Sometimes that can play into these numbers and might maybe give you perhaps a falsely high or low number. Most commonly, if people who are bodybuilders, for example, may have a high BMI, but their percent body fat is actually very low. So it kind of skews those numbers. So this is one number that we do use in the medical community, but it does have some limitation. Another number to really hone in on is your blood pressure. The top number is the systolic pressure, and that's the pressure while your heart is beating. And then the bottom number is the diastolic number, and that's actually when your heart is at rest between beats. I've included here kind of a chart from the Heart Association that gives you the classifications of where blood pressures fall. So a normal blood pressure is less than 120 over 80. It's considered elevated if it's 120 to 130 over 80. And then high blood pressure or hypertension stage 1 is when you're between that 130, 140 over 80 to 90. And then stage 2 hypertension is 140 over 190 or above. So those are just sort of the classifications. Typically, when you get into the high blood pressure, that 130 over 80 to 90 that's where we really start pushing. Well, when we're healthy and have a normal blood pressure, we should do the same. But once you get into those higher numbers, that's when we really push the lifestyle measures to help manage the blood pressure. And then if those aren't enough to get the blood pressure down into a reasonable level, then when you get to the stage 2 is when we look maybe towards pharmacologic treatment as well. As far as high blood pressure or hypertension, there are risk factors, including age, race, your family history, being overweight or obese, not exercising. Tobacco can influence blood pressure, eating too much salt, not eating enough potassium. Alcohol intake, excessive alcohol intake can elevate blood pressure. Stress can elevate blood pressure. And sometimes during pregnancy, we see the blood pressures go up. So there are some risk factors to be aware of. Here are some of those lifestyle measures and how they can impact your blood pressure. So weight loss is important. Even just a very small weight loss can majorly impact blood pressure. So even losing 2 pounds can drop your blood pressure by 5 points. So, if you lose 5-10 pounds, that can, in some situations, almost bring your blood pressure into a normal range, depending where you start. Healthy eating is also a factor, separate from weight loss itself. The quality of your diet can help your blood pressure. So that's where we really encourage fruits, vegetables, whole grains, low-fat dairy products. That healthy eating can drop your blood pressure by 10 points. Sodium, again, is another part of the diet that we can take a look at. Sodium, we think of the salt shaker, but the biggest place we get our sodium is from processed foods, restaurant eating. Those are places where we don't have control, and those items really contribute large amounts of sodium into our diet. So we want a minimally processed foods in our daily intake. We do also encourage dietary potassium. And when I say dietary potassium, I am talking about the potassium that comes naturally in fruits, vegetables, and those sorts of foods. But that, again, can impact your blood pressure. Physical activity can drop blood pressure. Both the cardio or the aerobic type exercise, along with resistance exercises, the combination of the two are very important. And then the last lifestyle measure here is alcohol intake. Alcohol intake can elevate blood pressure. So for those who do drink alcohol, we really recommend for men that the alcohol intake is 0 to 2 drinks a day. And women, it's 0 to 1 per day. And again, those sorts of changes all put together can significantly reduce blood pressure levels. Okay, so turning to cholesterol. So we have the good cholesterol and we have the bad cholesterol. So HDL is the good cholesterol or the healthy cholesterol. In this situation, higher is better. So basic goals for men is greater than 40, and in women, we like it over 50. Lifestyle things that you can do to improve your HDL include regular exercise, not smoking, losing weight. So those are ways to improve that number. And then on the other side of things, the LDL cholesterol, we want as low as possible. I align the H in the HDL to healthy cholesterol and the L in the LDL to lousy cholesterol so that you can kind of remember which is which. The goals for LDL are very individual. So if you are someone who already has had a heart attack, or you have some plaque in your arteries, we want that LDL under 70. And there are instances, if you are at really high risk, your provider might suggest that we try to get that LDL cholesterol under 55. If you happen to have diabetes along with heart disease, again, the guidelines suggest we get that LDL down under 55. Primary prevention, so if you have not had a heart attack, or you've not had an intervention, you don't have any plaque in your arteries, we consider that primary prevention. And the LDL goal really depends on your personal level of risk. You know, what are your risk factors? Do you have family history? Do you have a low HDL? Do you have high blood pressure? Do you have diabetes? All of those things factor into how low we want to treat your LDL cholesterol. So if you are very low risk, and let's say your LDL is 110, we might not recommend medication for you. But if you are someone who, let's say, has a really strong family history, and you have high blood pressure, you smoke, then chances are we're going to suggest we want that treated a little bit lower. LDL is largely affected by, partly by genetics, but from a lifestyle standpoint, saturated fat in the diet really impacts the LDL cholesterol. So our focus in treating the LDL is trying to get the saturated fats as low as possible, increasing the fiber intake through fiber-rich foods, and using those minimally processed foods as the bulk of our intake. Also on the lipid panel, in addition to the total cholesterol, the LDL and the HDL, is the triglycerides. Now, this portion of the lipid panel really needs to be drawn fasting. So should fast for about 10 to 12 hours prior to the test. Normal is under 150. So that's the ideal level. Triglycerides are classified as high at 200 to 500. And very high is considered over 500. If you do have high triglycerides, you are at higher risk for developing heart disease or stroke. Things you can do to improve your triglycerides from a lifestyle standpoint is regular exercise, losing weight if you're overweight, avoiding sugars, especially processed added sugars. So I'm not so concerned about the sugar that's in an apple, but I am concerned about the sugar that's in an apple muffin. So it's that added processed sugar that can really impact these triglycerides. Refined carbs, I call them a lot of the white stuff, the white bread, the white snack crackers, the pretzels, the white rice. All of those things really can impact triglycerides as well. Alcohol is another one of those items that can elevate triglycerides. So again, just as we talked earlier with blood pressure, the recommendation or the guideline for alcohol is no more than 0 to 2 for men, 0 to 1 for women. If you do have high triglycerides, I might drop that even a little bit lower. Smoking cessation also improves triglyceride levels, and getting adequate sleep is another one of those things that really helps triglyceride levels, along with stress management. One of those other numbers is our glucose number. Basically, we want to keep it under 100, and again, this should be done fasting. High levels could possibly be a sign of diabetes or prediabetes. And as far as the glucose, really the same lifestyle approaches, as we talked about for triglycerides, really also would go for elevated blood sugar levels or glucose levels. The last number that we are focusing on today is waist measurement. So that central adiposity is actually a risk factor or too much belly fat. In the old days, we might have referred to it as apple versus pear shape, so that apple's belly fat is a higher risk for developing heart disease. So as far as numbers, in men, we want the waist measurement to be under 40, and in women, under 35. Now, we're not talking about maybe the size trousers that you purchase. It's more of the circumference just right above the belly button. So it's not, you're not going, you know, if you have a belly that kind of hangs over, we're not going under that to get the waist measure. We're going right around where the belly button is. But that, again, belly fat is a risk factor both for high cholesterol and heart disease, and it's also increased risk for type 2 diabetes and high blood pressure. So that being said, again, here are the lifestyle dietary recommendations to improve all those numbers. Again, top of the list is whole foods, fruits, veggies, whole grains. If you look at a label of a whole grain, there should be very few ingredients. So brown rice should be brown rice or quinoa. It's not necessarily quinoa and oil and sodium and preservatives all together in that ingredient list. It's basically quinoa. Same thing with veggies. It can be fresh, it can be frozen, it can be canned, but we want it to be low sodium. So with veggies, if you're picking up a steamer pack of broccoli, we want it to be broccoli, not broccoli with an herb sauce with all kinds of sodium added, or cheese sauce. We want just the vegetable, and then you can add your seasonings. Low-fat dairy products, lean protein sources. So I would say fish, poultry without the skin, and then using some plant proteins in the bean or legume category. We want to use healthy oils. So again, we're trying to limit the saturated fats that we consume, and we want to focus more on the mono and polyunsaturated oils, and then nuts and seeds as well. Limiting sugar-sweetened beverages is a biggie, and then minimizing our intake of red meats, especially those fatty red meats, and then really paying attention to portion size and going moderate on portion size. Again, keeping the saturated fats in our diet down to about 5 to 6% of our total calories. And all of those are important both for cholesterol, diabetes, and high blood pressure. When we look at high blood pressure and our sodium intake, we really want to get the sodium down intake under 1,500 milligrams a day. If that's not something that you can do, I would say try to drop your intake by at least 1,000 milligrams a day. Oftentimes when we talk about high blood pressure, the diet that is named is the DASH diet, and the DASH diet stands for dietary approaches to stop hypertension. The other diet that we often talk about is Mediterranean diet. Both of them are very similar, and it again focuses on fruits, veggies, whole grains, lean proteins, healthy oils, and then minimally processed foods. So this is just a chart of a DASH diet. So again, grains should be whole grains, whole grain English muffins, whole wheat pita breads. The first ingredient should always be the word whole. Veggies, again, we're recommending anywhere from 3 to 6 servings of veggies every day. I would say the DASH diet focuses a little bit more heavily on the veggies and the fruits. Fruits are recommended 4 to 6 servings a day. An apple that's about the size of a tennis ball is considered 1 serving, you know, so sometimes our apples might be larger, so that may actually be 2, but, you know, getting a good variety. So between these fruits and vegetables, whether you're trying to model the DASH diet or the Mediterranean diet, the important thing is to get lots of color. So mix up the greens and the reds and the yellows and the oranges and the whites and the purples. By doing that, you're going to get the wide variety of nutrients that we need. As far as dairy, we say low fat. Meats need to be lean. And here we're going 3 to 6 ounces for the entire day. So trimming down the meat portions. And that includes poultry. When I'm saying limit meat portions, I also include in that same category poultry. So moderation is a key. The 3 ounce reference would be like a deck of cards or the palm of your hand. And then encouraging nuts and seeds in there as well. The nuts and seeds have a nice type of fat and then a good amount of fiber. This is just the overview of a Mediterranean diet. And again, it's very similar. Lots of veggies, beans, legumes, fruits, whole grains. So the numbers are just slightly different, but overall, it goes back to including fruits, veggies, whole grains, low-fat proteins, and Mediterranean does focus a little bit more on fish, and we recommend at least 2 fish meals a week. I like to think of my plate in kind of a breakdown where half of your volume, half of your plate should be filled with veggies and fruits. So your plant fruits and your produce should make up half your plate. The other half is a combination of your whole grains or your complex starches, and then your healthy protein. Most of the time when we're not, at least for me, if I'm not planning very well and I'm not thinking through and I'm in a hurry, then I might skip the whole left side, the veggies and the fruits. That typically is what gets skipped. And then added sugars, the Heart Association has really focused on trying to trim our added sugars in our diet. For women, they suggest under 25 grams of added sugars, and for men, they say under 36 grams. So I would, and the food industry has started adding this on the food label, so you can look at the nutrition panel, and it will tell you how many grams of added sugars are in the particular foods that you're choosing. So I say take a peek at your food labels and kind of do a tally of where you are sugar-wise. And then activity, the Heart Association guidelines are to move more. And again, this is to impact both our cholesterol, LDL, HDL, triglycerides, and blood pressure, and actually blood sugar for that matter. But we want to move at least 150 minutes a week of cardio or aerobic activity. They recommend at least 2 days of resistance or weight training. And they encourage us to sit less. So if you have a sedentary job, you know, get up and move around throughout the day. You know, go get a drink of water, you know, just stand up. If you're on a meeting, maybe it means just standing up if you're on a meeting like this. And then add intensity. So rather than just leisurely walking, you know, can you increase the time? Can you increase the distance? Can you make it a little bit more intense of a workout? So increasing that intensity is important. So I always like to end these talks with kind of a call to action. So we talk about what the numbers should be, but it turns back to what can we do? What actions can we do in our lifestyle to impact those numbers? It could be, you know, not having seconds. You fill your plate to a moderate amount and you don't go back for additional servings of anything, let's say, other than veggies. Eating at least twice a day. You know, I meet with a lot of people who maybe have one meal a day. So I really encourage at least 2 or 3 meals a day. Maybe it's about eating veggies, or eating more fruits, or change, or maybe it means, I don't know if you're a grazer, maybe it means not snacking throughout the day. You know, thinking about, am I hungry? Am I not hungry? Does it mean that you should focus maybe on planning your meals and working on food prep? You know, we might have the intent when we go to the grocery store, we buy all this produce, but we never do anything. And then a week later, it's all mushy in the drawer in the fridge. So does that mean taking some time and cleaning it, chopping it up, bringing it to the front of your refrigerator so you see it? Or do you focus on mindless eating? Like not eating in your car, let's say, or not eating while you're watching TV or you're on the computer, or if you're a dessert person or a pop person. So just take a look at what some of your habits are and where can you make some healthy changes. So I suggest coming up with 1 or 2 food-related goals and 1 activity goal. Write them out and then periodically reassess where you are. So you just want to keep building on those positive changes. We're not going to necessarily make all of this happen in one day. So, you know, go at it slowly, but be persistent and gradual. Again, think about what can you do exercise-wise. And again, identify what you want to work on. What you want to work on might be different than what I need to work on. Make some goals that are reasonable. Make them very specific, measurable. Saying that you want to lose 50 pounds by next week. Now, you know what? That's not probably going to happen. So that's not really an attainable goal. So just be very specific and really speak in terms of action or behaviors. So when you change how you eat or how you move, eventually the weight's going to change, your BMI is going to change, your blood pressure is going to change, lipids are going to get better. All of those numbers that we need to worry about will eventually get better as we work on these healthy behaviors. This is just an overview of our prevention and wellness clinic. We have Dr. Martin as our medical director. We work out of 3 offices, Ankeny, Carroll, and West Des Moines. And I am the dietitian here at the West University office. And I do visit with folks as far as healthy eating and nutrition consults. That is all I have for you today. If you do have questions, please let me know.
Thanks, Diane. If anyone had any questions, the chat was there. I had a couple of questions that maybe people aren't thinking to ask that I wanted to ask Diane. The first one is about caffeine consumption, and maybe I missed it, but like we get this a lot, especially when we're trying to educate youth about nutrition and lifestyle choices and energy drinks and caffeine. So can you share more about, you know, is caffeine, number one, good for kids? And number 2, just for any of us, you know, where should we have our caffeine consumption at per day?
Good question. The guideline for caffeine is up to 4 cups of coffee. So that's about 200 milligrams of caffeine, I would say, in a day. Under that would be ideal. I am not a big fan of energy drinks. I think we really need to take a look at the food labels on those drinks. Sometimes they're loaded with sugar, sometimes they're very high in caffeine, and sometimes they're high in B vitamins. So none of those necessarily are good for us. So my 2 points on this is if we're feeling sluggish and tired, we really should look at our sleep habits and eating healthy. If we're thirsty, in most cases, we probably need water. Now, that's not to say you have to be at 0 caffeine. And caffeine is also a little bit more tied into, if you have arrhythmias or irregular heartbeats, then that might be more of a trigger for you. So do work with your provider. But for hypertension, the guideline was up to 4 cups of coffee per day. And I'm talking cups that are 8 ounces, not the 20 ounce or whatever.
Sure. Okay. And then my last question that I had was really around when we think about knowing your numbers, right? How often should we, for example, check our blood pressure? How often should we get our, cholesterol checked? And also, I feel like, yeah, at what age should we start checking all of those things?
In children, I did not look specifically at the guideline for when to start measuring actual blood levels of cholesterol, but definitely if you have a family history of heart disease, those things should be checked early. And I would have that directed by your provider. At least I would say probably an annual on your cholesterol and blood sugar, so kind of your annual physical. If there is stuff that is elevated, then I think it needs to be monitored more closely. And, in our clinic, if your blood pressure is high when you're in the office, that doesn't mean when you're sitting at home, it's normal or that it's elevated. So, sometimes situational things, it might be a good idea to check just to know where you are, because you can't feel high blood pressure. You don't know what there's not a symptom for high blood pressure. So, if there's ever an opportunity to screen, it's probably worth it.
So blood pressure, your cholesterol, triglyceride levels, all that stuff. Is there anything else? I feel like there's another screening that maybe you guys offer too that I'm not, calcium scoring? Is that something that's related to this or not?
It is, and calcium scoring would be indicated in, so calcium scores are quick CT scans of the chest where the heart is, and we're screening for calcified plaque. So typically, if you're a little bit older, I think it's 50 is the age cutoff for men if you don't have, so it's tied to risk factors. So if you have multiple risk factors, then a calcium score might be indicated for screening for heart disease. Doing a calcium score in a 25-year-old probably isn't going to show anything because the plaque hasn't been there long enough to calcify. So that would be maybe in an older or higher risk population, but it is a good screening tool. If you do have family history, especially, and you have high cholesterol or you have high blood pressure, or diabetes, that's a nice screening tool to really get a better picture of what's going on in you personally in those arteries. And then we also offer vascular screening, which the calcium score is focused on the heart, but we also do screenings where we're looking at the carotid arteries. We're looking at the abdomen for aneurysms. We're looking at the pressures in the legs to see if there's any limited blood flow in the legs. So those are all easy screening tools that if you have risk factors, especially family history, or like I said, you have high cholesterol, diabetes, those are good screening tools.
Great, thanks so much. Again, thank you for being here and being a frequent flyer, I guess, a frequent guest on our Iowa Has Heart webinar series. We appreciate your expertise and all that you do for your patients in the community. If you are interested in learning more about future webinars, follow us on social media. We're on Instagram, X, Facebook, LinkedIn, all the good stuff. And we post these webinars on our YouTube page. So again, you can go back and share these with others or revisit them if you need to. We appreciate you being here today and look forward to seeing you in the future. Take care, everyone.
Thank you. Bye-bye.
Thanks, Diane.